Hi, are you thinking about getting a rhinoplasty, but you're just not sure how the whole recovery is going to work out with work and with life? I'm Dr. Dominic Castellano, Elite Facial Plastic Surgery, and I want to kind of break down post-rhinoplasty care, what you can expect, and some timelines. Now, from the point of surgery, you will leave your procedure having a splint on the nose. Normally that splint is covering the upper one half, and then you'll have tape as well. And that splint, in most surgical practice, are going to stay on anywhere from 5 to 7 days. During that time period, I recommend my patients to put some ice one over each eye, not on the nose, but kind of resting on the eye and the cheekbone to help with the swelling and to reduce some bruising. I normally recommend patients to do that for like 20 minutes on, 20 minutes off for the first 4 hours. Then after that point, there's really not much more you need to do from an icing standpoint. I also tell patients to avoid blowing your nose. Don't do any heavy lifting or strenuous activity. Just kind of take it easy. Now, the one thing that you can do during that recovery process is if you have what we call an open approach rhinoplasty, is there'll be a small incision going across this part of the nose called the columella. And what you want to do is clean that with a very small amount of peroxide, dab it, don't rub it, and then put a little bit of what I like to use is either Aquaphor or an antibiotic ointment called bacitracin, just to keep it clean. It doesn't have to stay gooped on. Most patients don't like the swelling inside the nose, and I totally understand, but you gotta abstain from blowing your nose to let the incisions and the area heal. From that point of surgery to the point of being seen 5 to 7 days later, you'll follow up. That splint will come off, and I'm sure you're thinking it's painful. It's not. The only time it's normally painful is somebody's rushing to take it off. In my practice, we take our time, we soften up the tape, and the splint comes off very gently, and then the 5 little sutures that are in the nose come off as well. I'll also put on some adhesive material on the nose, so that way I can put tape back on, and I normally have you keep that tape on for about another 2 to 3 days. At the 2 to 3 day standpoint, I have you put alcohol on your nose at home, I have you take a shower and get it wet, and then put alcohol, and that tape usually comes off. At that point in time, it's normally just leave the nose alone and let it heal. I typically like to see my patients back a week later for their 2-week follow-up, just to make sure things are healing up well, make sure they don't have any questions about anything. And then normally I see you back 2 weeks after that at 1 month, and then normally I'll see you back 2 months later for your 3 month, and then 6 months, and then 9 months if needed. The timeline of recovery. If you do any reading on rhinoplasty online, you'll see that most surgeons are going to say with consistency that with a primary rhinoplasty, you need to give your nose about a good 9 to 12 months to kind of let the swelling settle. What I like to tell patients is that the swelling kind of occurs in stages. It's not like you wake up one morning and bang, it's all gone. What happens is as the swelling starts, the whole nose is swollen, right? You take that cast off, which is overlying the bone and the cartilage, and there will be some reflexive swelling that comes back because the skin, the tissue is going to absorb some of that swelling. But then what ends up happening is when that splint comes off, the clock starts. And at that point in time, the swelling starts to go down in monthly intervals. And so I like to tell patients the last area to settle out is the nasal tip, which is the most inferiorly or lower portion of the surgical field. Plus, it's the area where the lymphatics are reconnecting to drain that excess fluid. Now, the other reason why I think there's a lot of swelling that tends to persist there is because it's mainly cartilage and soft tissue in that region. And that tissue tends to take the longest. So I'm often seeing patients and counseling patients just to tell them to hang in there, but you'll be amazed at how much your nose will change from that point of surgery to when you're at least 9 to 12 months out. Now, one of the big things that patients often inquire about is it, quote, painful? I'd say 90 to 95% of the rhinoplasties that I do are not painful. Now, there is soreness. There's a difference between being sore and having pain. Soreness is usually controlled by anti-inflammatories like Motrin or Advil. Pain sometimes may need to be remedied with pain medications. Now, let's be honest, everybody has a different level of pain tolerance. But for the most part, that pain should go away after about a day or so to where you can manage your discomfort with a little bit of Motrin or Advil and possibly some Tylenol as well. But after a couple days, you shouldn't need anything. Now, I'm sure you're wondering about the dreaded splints. With rhinoplasties that are just changing the outside of the nose, you normally don't need to have the dreaded nasal splint inside the nose. For my patients, I normally don't use them at all. So the only thing that's coming out of your nose when you follow up is just those 5 little sutures that are at the base of your nose. With those sutures, I know a lot of patients are concerned about having an incision. That incision heals up beautifully. The incision that is only minorly seen is right across the nose here, but when that heals up, it is not perceptible. The remainder of the incision is inside the nose, and you don't have to do anything with it because there are absorbable sutures, and it's the beauty of the technique that I use. You don't have to do anything to it. The hardest part for you as the patient is just being just that, the patient. Give your nose time to heal. If you have any questions or concerns, call your surgeon. But that's why I see you so often, is just to make sure things are healing up well. Now, I will say there are some instances where something may need to be done. Let's say a steroid injection. A common area is normally going to be up what we call in the super tip area. That's normally going to be reserved for people who have a very large amount of swelling that's not going down, or for patients who have thicker skin type envelopes. Again, I can't tell you for sure, everybody is different, but those are the times when maybe something may need to be done. Now, another common thing that I often hear is patients wanting to keep retaping their nose. I normally don't encourage patients to do that because then you can kind of irritate the skin, and you become obsessive about it. I just tell patients, leave your nose alone and let it heal, and let me or whomever your surgeon is guide you through the process. I hope this sheds some light on the post-rhinoplasty care. If you have any comments, feel free to leave them in the comments section, or if you'd like, give us a call or email. We'd love to talk to you and answer your questions.